Hello, I'm Eric Garcia, nurse practitioner student for adult geriatric acute care nurse practitioner at UTEP. This is my history and physical exam for adult geriatric advanced clinical practicum 1. Attending physician is Dr. Farouk Ahmed. Chief complaint was scheduled procedure for breast reconstruction, status post-mastectomy. Patient was diagnosed with breast cancer several months ago. History of present illness. As mentioned, she was diagnosed with breast cancer back in January. She received a bilateral mastectomy in March and had been planning on breast reconstruction post-mastectomy, but was delayed due to coronavirus. She is now admitted to the hospital and already received her breast reconstructive surgery with plastic surgery period. She is being admitted under us for medical management. She does have the prior history of breast cancer, as noted. It is now in remission and her treatment has been completed with chemotherapy and radiation. Patient did tolerate procedure well and was evaluated in PACU status post-procedure without any complications. Patient was drowsy from anesthesia. She also has a history of hypothyroidism as well as hyperlipidemia, which will be continued to be monitored and managed as a patient period. She is a 53-year-old Hispanic female. Past medical history. Patient has a past medical history significant for breast cancer, in remission. She also has a history of hypothyroidism, overactive bladder, and hyperlipidemia. Past surgical history of mastectomy, hysterectomy, as well as recent breast reconstruction. Her home medications include alprazolam 0.5 milligrams, oral tablet, BID as needed for anxiety and insomnia. Patient states she hardly takes this. Mixed medication she's on is levothyroxine, 50 micrograms daily every morning by itself. She also takes oxybutynin, 10 milligrams daily, rosuvastatin, 5 milligrams daily oral, and trazodone, 75 milligrams oral at bedtime. Patient has no known drug allergies, but she is allergic to nuts where she gets a skin rash if she eats them. Family history. Patient states family history is positive for hypertension and diabetes from both her mother and father's side. Social history. Patient denies any smoking, drinking, or illicit drug use. Patient does live at home, alone in a single-story house. Patient states she has good family support. Family is present at bedside and PACU status post-surgery, helping with H&P. Review of systems. Patient denies any fever, fatigue, or weight changes, no vision problems or changes, no congestion, ear pain, or sore throat. Patient does state some phlegm status post-general anesthesia. Cardiovascular, no chest pain, palpitations, or edema. Respiratory, denies any cough, congestion, wheezing, or shortness of breath. All of their systems are negative. Patient does have surgical incision to bilateral breast from recent surgery. Dressing applied right now, not to be removed until tomorrow by surgeon. Her physical exam, vital signs are stable and within normal limits. Oxygenating well on 2 liters. Physical exam is unremarkable. Patient is breathing somewhat shallow due to pain and recent anesthesia. Surgical incisions are present to bilateral breasts. Eye hole opening with 2 JP drains on each side noted with minimal sanguineous drainage. No lab data has been drawn in the past 48 hours, will be repeated in the morning. Assessment. 1. History of breast cancer status post-breast reconstruction. 2. History of bilateral mastectomy. 3. History of hysterectomy. 4. Hypothyroidism. 5. Hyperlipidemia. 6. Overactive bladder. 7. Insomnia. 8. Acute pain due to surgery. And our plan will be to admit patient to med-surg unit status post-surgery with clear liquid diet and advances tolerated. We will also monitor for any complications such as bleeding or infection. Advanced diet is tolerated as previously mentioned. 3. Follow up as outpatient with PCP and established oncologist, as well as plastic surgeon within 1 to 2 weeks. 4. Continue levothyroxine as home dose. 5. Restart statin home dose. 6. Continue oxybutynin home dose. 7. Continue trazodone at bedtime home dose. 8. Add PRN pain medications to control pain and encourage ambulation. 9. Apply SCDs. Will restart Lovenox tomorrow for DVD prophylaxis as well as famotidine for PUD prophylaxis. Rehab services also have been consulted for evaluation and treatment, and social work consult as well for discharge planning. Patient appears stable at this time. We will continue to follow with lab results and evaluation tomorrow steps post-surgery. Thank you.